And it is Urology Awareness Month, so a time to raise awareness for urology diseases. This afternoon, we have Dr. Bryan Sack from Nationwide Children's Toledo, so we could talk more about what to look out for in pediatric patients. Thanks for being here today. So, okay, first of all, what are some urology diseases in kids? I think maybe a lot of parents are aware of, well, I need to watch out for this or that, but that might not be something that's on their radar.
Yeah, no, you're right. I think a lot of the diagnoses that we see are surprises to family, but something that's very common that we see is we see a lot of like newborn babies that maybe they saw something on their kidneys on the prenatal ultrasound, maybe a little bit of fluid or urine that wasn't draining down into the kidneys appropriately. So we'll kind of help navigate that whole process with the families, additional ultrasounds or other studies to kind of help figure out what's going on. Some other things, maybe just diagnose on a physical exam that they're seeing at their well child visit. A common diagnosis, something called an undescended testicle. Maybe the testicle didn't make its way all the way down from the groin into the scrotum, and maybe they need a small procedure to help them with that as well.
And so these are just a couple things that your regular pediatrician might pick up and refer to someone like you, right?
Yep, absolutely. I mean, like through the physical exam and also like a good history about learning about like how well they're doing with urinating. Are they having lots of accidents? They're having difficulty with toiletrading. Maybe they're even having urinary tract infections and burning and pain and fevers, all reasons to send them to a pediatric urologist.
And these could be things that you don't realize is a bigger issue until you investigate a little bit further.
100%. Yep. Sometimes they're bigger issues and sometimes they're actually smaller issues, and we can just provide reassurance for the family because maybe the pediatrician isn't as comfortable with the diagnosis, and we can help just provide some reassurance to the family that things are going to be okay and just monitoring things conservatively will be just fine.
Sometimes, so these kids, as you mentioned, this gets picked up on neonatal ultrasound, so you're seeing really little ones sometimes.
Yeah,
huh?
Sometimes we even see moms too. Sometimes the moms come in too because they get something detected on a prenatal ultrasound. They'll come in, they'll see us, they'll ask us for an opinion about what to expect after baby is born to kind of help them navigate that process. And again, that's also very reassuring to the family because a lot of time we can put people at ease to make them feel comfortable with whatever's going on.
So what are some things that we need to be looking out for in terms of signs, symptoms that a parent might, panic about, or maybe some should cause more alarm?
Yeah, no, another great question. I think a lot of the things can be just based on physical exam or on an ultrasound, but there are things that do have symptoms. I mean, people I've heard of kidney stones. Adults get kidney stones, right? Well, kids get kidney stones too. Maybe not till they're like later childhood or early adolescence. So we help navigate that process. And another thing that's important to know about is something called testicular torsion. The testicle can twist. It can lose its blood supply. That's like a surgical emergency. So if ever your son or a boy that you know is having extreme pain or swelling down in that area, make sure you go to the emergency department promptly so we can kind of help take care of it and untwist it for them to help keep that testicle alive.
I think sometimes kids, it's hard because they want to tell you what's going on and they may not be able to get those words out just right. So it could be a situation where a parent says, okay, I know something's not quite right, but we need somebody else to dig a little deeper and figure out what exactly is going on.
Yeah, 100%. A lot of these areas are sensitive to the families, to the patients, hard to kind of talk about. So if you're ever uncertain, go to your pediatrician, go to your local urgent care or emergency department if those things are going on. But, just good education of the child about their own anatomy is also super important for these kids.
Yeah, and to grow up, making sure that we learn certain terminology and certain things, because then those conversations can be that much easier, right?
I couldn't be in more support of that comment. I mean, like teaching the normal anatomic terms of what they have and what it is so they can kind of communicate to their teacher if there's a problem, to wherever they are if there's a problem, to their parents, to their aunt, to their uncle. I mean, it's super important that they understand what their anatomy is so they can help describe what's going on if there's a problem.
And depending on who's there at any given moment, because it may not be mom or dad who understands, whatever words or language that you've developed over the course of your young life with your kids.
You're absolutely right.
Yeah. So we are raising awareness the month of September. Why do you think that is so important that we do that?
I mean, I think it's like little things about just educating about like your body and some of the problems that can go on. Sometimes people aren't aware of these problems and they let them kind of linger for months or even sometimes years if there's an issue where if they were brought in sooner, we'd be able to kind of help care for them and help them navigate through that issue a lot sooner and potentially make their quality of life a lot better.
Yep, so that's what we're going to do this month, raise some awareness. And again, parents, you need a little bit of extra help, make that phone call and get that appointment. Doctor, thank you so much for being here today.
Thanks so much for your time.
Appreciate it. Yep.